Hello, welcome to today's Insta Live, and today we're going to talk about implantation bleeding. And I have a very special guest today. It's Dr. Katharina. I'm going to bring her into the conversation. And it's such an important topic because when you are hoping to be pregnant, the last thing you want to see is a bleed, and it can be so scary. So let's talk to Dr. Katharina to understand what is implantation bleeding, how can it be different from all kinds of bleedings, what does it mean, is it normal? So let's see if we can bring
Andrea,
Dr. Katharina
can you hear me?
To join us. And of course, if you have any questions, you can write them in the chat function. And I'm trying to manage these invitations. I don't know if Dr. Katharina is here seeing our request to join. And have you experienced implantation bleeding, any of you? I'd be really interested to know, how common is it, implantation bleeding? I don't know if Dr. Katharina is here with us. Oh yeah, I can see here in your request. Sometimes managing all this technology is not easy.
Hello.
It's a challenge to manage all this technology.
Yes, I think this is the most difficult. I'm sorry. How are you doing?
I'm okay. How are you?
I'm fine, thank you. So nice to see you.
Yes, it's nice to see you, and it's a pleasure to speak with you about such an important topic, because I think having a bleed when you're hoping to be pregnant is very scary. It's one of the scary things those are expected to be pregnant.
Exactly. It's a hard topic, because if you start to bleed, as you said, you get scared. We can tell the patients, don't worry, but it's normal to worry. But I hope that after today, maybe they worry a little bit less.
So maybe let's start from the beginning. Can you tell me a bit about what is implantation bleeding?
So implantation bleeding is normally a small amount of bleeding which takes part between the transfer, the embryo transfer, and the pregnancy test. So you know that normally we wait, if the transfer is of a day 5 embryo, we wait 12 days until the pregnancy test. And normally this bleeding is about more or less 1 week after the transfer. And it's like the most typical 5 to 7 days after the transfer. So some days before we could expect menstruation, or more or less when we can expect menstruation in a natural setting.
It can be quite confusing, isn't it, if it's around that time, because women get a bit anxious. My period just come, or
exactly. Normally, most patients call us and say, "Okay, I just started with my period," and then we say, "Okay, when did you have the transfer?" Look, we check when was the transfer. As I told you, normally it's like more or less 1 week after the transfer. And then what you can do is you have to wait. The only thing we can really do is patience, and normally this kind of bleeding is limited. It's 1 day, 2 days. It's also a small amount, and then normally it stops. And afterwards, if there was an implantation, of course, there's no menstruation.
So that's one of the key differences then between menstruation and the implantation bleeding is the duration. So here they should expect just 1-2 days, and the amount as well much less than normal menstruation.
Exactly. In the implantation bleeding, it's the count normally is much less than the menstruation. It's like the spotting in the beginning of menstruation. It doesn't get more during the time. It stays like this. Sometimes it comes and goes, but it's not like a bleeding that gets more and more and more. And normally it's limited. It's 1, 2, maximum 3 days. And menstruation normally starts with spotting, or can start with spotting, and then it gets more and more, and it takes some days more. Normally it's 3, 4, 5 days.
And the way it looks, sorry, sorry, I was interested, but the way it looks, if it looks different as well.
It's difficult sometimes to make a difference. It's true that the implantation bleeding is maybe a little bit darker. It's a darker color, and so it's not like fresh blood, like really red. So it's dark red, sometimes a little bit more brown, but it can also vary from patient to patient. This is really difficult to tell. But we mostly tell is the timing. If it's like 5 to 7 days after the transfer, we normally say, okay, might be implantation bleeding. Mostly it's also without pain. This is also important. And the implantation bleeding is normally just the bleeding, no other symptoms, no pain. And menstruation can be associated more with pain, and also depends on the pain.
So that's an important difference as well.
Yes,
and
yes.
I would imagine that if women are trying naturally, they could potentially also experience implantation bleeding as well. But it's more difficult to see the timings, isn't it?
Exactly. So sometimes, even if it happens that a woman has an implantation bleeding, thinks that this is her period, and then just keeps trying to get pregnant or not. Maybe she's trying, and then the second menstruation is not coming. So then they do the ultrasound, and sometimes you see, okay, the pregnancy is already more time, more weeks than we expected from the last menstruation, because it can be really confounding.
Yeah, especially if women have irregular cycles, isn't it? And
exactly that. It's very, very difficult in a natural cycle, it's sometimes very difficult to make a difference. Of course, we're like, if you do the treatments, if you do the transfer, I'm more for the transfer than for insemination, the artificial insemination treatments. You're so aware of your body that like every spot of blood you have, you're aware, and you get anxious. So there is like more control. In a natural cycle, a lot of women don't notice the implantation bleeding because they think that it's just their period.
And we have here a question. Someone is asking about bleeding after the pregnancy test.
This can also happen, and it doesn't mean that this is going to be a miscarriage. The thing of bleeding in the early pregnancy is that the embryo is implanting inside the uterus. So you can imagine that this small embryo is like creating its space, and in doing like a kind of invasion inside the endometrium, inside the uterus, in order to form the placenta. And by doing this invasion, sometimes they hurt small blood vessels, and these small blood vessels can bleed. And this is the bleeding, or in the implantation, or also in the early pregnancy, early weeks of pregnancies. Of course, if you have a bleeding after the positive pregnancy test, which gets more and more and more, and which is accompanied, for example, by pain, then we have to be careful. We have to check if it's a miscarriage, if it's an extrauterine pregnancy, and so on. But there, what we would do is, depending on the weeks of pregnancy, doing controls of the beta HCG values, so for the pregnancy value, every 48 hours, and then as soon as possible also doing early ultrasound controls in order to check that really everything is fine.
Okay. And I imagine that it doesn't happen to everyone, does it? The implantation bleeding, or it's not like it's a sign that implantation has happened.
Exactly. We calculate that it happens about to 25-30% of the patients after
Okay.
a transfer. So we always tell the patients, if you bleed, it doesn't it doesn't mean that you are not pregnant. But if you don't bleed, it also doesn't mean that you didn't have an implantation. Yeah? So it can happen. It's more normal that it does not happen. So about 30% yes, about 70% not. But if you bleed, it does not mean that there's anything wrong. And so it can still be a sign of a good prognosis.
Yes, okay. And we have here a follow-on question. If the beta HCG keeps increasing after this bleeding, that's a good sign then, isn't it?
Yes, normally yes. So what we think is if the beta grows, doubles, right? It really has to double every 48 hours, it's a good sign. Right? Then do we have to be careful or like more alert if the beta value does not double, or but of course if it does not double, if it stays more or less the same, then we have to think about or miscarriage or extrauterine pregnancy. And if you see that it goes down, then normally it's because of a miscarriage or of a biochemical pregnancy. But if it doubles, we can tell the patient, okay, we have to continue, we have to wait, and we have to rest. Of course, we always recommend to rest, to stop taking aspirin, to stop taking the heparin, and to wait. What we also normally do is to raise a little bit of medication, for example, to raise the progesterone intake or to change from the vaginal administration to intramuscular administration and so on, subcutaneous injections, in order to try to do whatever is in our hands to keep this pregnancy going, of course.
I think, again, another question, how many times should the beta HCG be repeated? I think you've mentioned every 48 hours.
Yes, so normally we recommend to repeat it every 48 hours. If we see that, for example, in 2 or 3 controls and everything is well, and then the patient doesn't bleed anymore and feels well, we tell her, okay, do an ultrasound in the next 5 to 7 days. Okay. But if we see that the bleeding continues or that the value doesn't double exactly but raises, we normally continue with the controls every 48 hours until the value is more or less in 1000, and that's when we do the ultrasound, because that's the moment when you have to see something in the ultrasound. 1000 units per milliliter.
Okay, so I would say from what we've been talking, if there is just a small bleed for 1 or 2 days and there is no pain, then usually patients wouldn't have to necessarily contact the clinic at that point. They can just expect that it's normal, or would they typically contact just to get reassurance?
Normally we tell the patients that if it's just like one spot of blood or like 1 hour that you're bleeding, it's not necessary to contact, but in case of doubt, we prefer that they contact us, and then we can explain them, we can tell them what to do, and maybe we can do the pregnancy test earlier and things like this, or we consider raising the medication. It really depends on every patient. Imagine that it's a patient that has already had several miscarriages, and would of course do like a more stricter control than if it's the first transfer. So it depends on every patient, but in case of doubt, I always recommend to contact the clinic, because we are here. We always work with this. We know what it's about, and then we can explain the patients and accompany them.
And I'm curious about the concept of signs and symptoms during that 2-week wait after the embryo transfer. Can patients really notice any other signs or symptoms that they might or might not be pregnant? Because it's always such a common question. And of course, patients are more aware of their bodies because it's such a challenging time during that phase of treatment?
It's a good question. It's a difficult question because there are patients who notice something and there are patients who don't notice anything. And really, you can't tell about the symptoms. You can't tell if a patient is pregnant or not. It also can be on every cycle, on every transfer. There can be symptoms in one transfer and you are not pregnant, and in the next transfer you don't notice anything, and then the beta is in 500. Which are the normal symptoms or symptoms that can be normal? Can be like sensitive breasts, can be a little bit of pain, like abdominal pain, headache, nausea. Some women also notice that their basic temperature is a little bit higher. Things like this. But it can also be normal to not notice anything. The problem is that the medication you normally give to the patients also can produce these symptoms.
Okay.
For example, progesterone can make that your breasts are more sensitive, or can make you feel very tired, and this can also happen because of pregnancy. So normally it's a little bit of combination. It's the same. We tell the patients the symptoms that can be normal, that they don't have to worry about it, but it can also be completely normal that you don't notice anything.
And Dr. Katharina, I wanted to talk a bit about the fertility show because it's coming up in a few days, and I know that you will be there at the Vida Fertility stand. Do you want to tell us a bit about what can patients expect of this event?
I'm really excited to be there. I'm looking forward to it. We're going to be there with my colleague from Alicante, with Dr. Natalia Slab and me, and then our English-speaking colleagues from patient attention. And what we are offering is personalized first visits during the fertility show. So you can ask online for a first visit. You can also ask for it during the fertility days. Normally, from our experience, we always manage to give the patients who are interested a first visit. And then what we do is we meet with one of the doctors, or with my colleague or with me, and we review a little bit the history, the personal history, the treatments that you have already done. If you want to bring exams or reports of the treatments that you have already done, it's also no problem. We get through it, we talk about it, we see different options of like exams that we can recommend to do. And then we try to do a personalized treatment plan. And then the colleagues from patient attention also give the patients information about where we are, how we are organized, how we work, about the costs. This is also very important, and all these things. And then normally what we offer as well is, because there, of course, it's not the same than doing all this in a face-to-face and private, intimate consultory. So what we normally offer is, after these fertility days, and to do another Skype conference or WhatsApp conference to talk well about it, and also in details. And this is also included.
So it's a great opportunity, isn't it? Because patients, I imagine, some of them have been trying for a while, and they have all these questions, and they're looking for some answer, and it's a great opportunity to get answers from experts. And I think it's a great opportunity.
Yeah, I think it's also a good opportunity to meet us personally.
Yeah.
What we've seen in the last years is that you can do a lot of things online, a lot of things, but it's not the same than if you meet the persons who are going to work together with, you're going to be with them for the next couple of months, like personally. If you see how they are, how they work, really, how is the stand, how is everything, and then you get like a little bit more feeling about how you're going to to be treated, how they're going to work, and so on.
Yeah,
And then, of course, all the questions, we are there in order to answer or to try to answer all the questions. Yeah? My colleague, Dr. Slav, is also going to have like a speech during
okay.
his fertility days. I think it's like a question and answer round, or like ask the expert. Yeah, so it's
Is
I
it
think it's
on Saturday or the Sunday?
I think it's on Saturday. Yeah,
Okay.
I think it's already on Saturday. Yes.
Yeah. And I
Yeah.
will share the link as well to the free consultations because it's such an amazing opportunity. And I know that the event is happening hybrid. So for people who are not in London, they can still get to know your clinic and speak to someone from your team as well.
Of course, exactly. Yeah. As I told you, we're used to work online, so it's not necessary to go there, but it's also really nice. This is a personal experience. Eh? It's also nice to get in touch again.
Yes, I think that's going to be the peak after 2.5 years of not being able to see each other face to face at the event. I think it's going to be great.
Exactly. In Spain now it's not it's allowed again to go out without your face mask, and it's such a strange feeling, really. No? But
Yes.
everybody's smiling, and inside the clinics it's still recommended to wear them. Yeah? But it's already different. Yeah?
Yes,
It's
yes.
going to get
Everyone is a bit more relaxed about things.
yeah.
Dr. Katharina, it was really nice speaking to you today. I
It was a
will
pleasure.
I will share the video here and also on YouTube. I will also share the link to book the pre-consultations, the link for the fertility show. And I'm really looking forward to seeing you on Saturday as well,
You going to
face
be
to
there?
face.
Yes. Yeah, the first time we met face to face. I'm looking
Yes,
forward to it.
yes.
Thank you. And
Thank you.
I would say if you understand F42.
F42, brilliant. Go
F42.
find Dr.
You
Katharina
will have it done.
F42.
Perfect.
Thank you, Dr. Katharina.
Thank you. Have a nice evening.
Bye.
Bye. Bye.